Okay everyone, and welcome back. In this video, we're rediving deep into a topic that is practically guaranteed to show up on your USMLE Step 1 exam, the 3 types of AV blocks. Now, why are we focusing so much on these? It's simple. At this stage of your medical training, the exam writers aren't expecting you to be an EKG wizard who can interpret every complex rhythm under the sun. Instead, they test a small, high-yield set of patterns over and over again. And right at the top of that list, you guessed it, TV blocks. Besides your basic sinus rhythm, atrial fibrillation, and atrial flutter, AV blocks are one of the most common rhythms you'll encounter on your test. That means you're almost certain to see at least one question on them. So, mastering this topic is a fantastic way to lock in some points. Before we get into the blocks themselves, let's do a super quick review of a normal sinus rhythm. On a healthy EKG, you see a P wave, which is atrial depolarization, followed by a QRS complex for ventricular depolarization, and then a T wave for ventricular repolarization. The key measurement for us today is the PR interval, SKU. We measure this from the start of the P wave to the start of the QRS complex. Normally, this interval should be less than 200 milliseconds, which on EKG paper is less than 5 small boxes. If that PR interval stretches out beyond 5 small boxes, it's considered prolonged. And that's our first big clue that we might be dealing with an atrioventricular or a V block. So, what is an AV block? It's a delay or disruption in the electrical signal as it travels from the atria, through the AV node, and down into the ventricles via the Hispakin system. When this pathway gets messed up, the heart's contractions become uncoordinated and inefficient. Clinically, this often presents as bradycardia, or a slow heart rate. Patients might complain of feeling dizzy, lightheaded, or even passing out, which is syncope. When you see these symptoms in an exam question, your brain should immediately start thinking about a conduction problem, like an AV block. Alright, let's start with the easiest one. First degree, AV block. This one is super straightforward. The rule is simple. Every single P wave is followed by a QRS complex. Zora, no dropped beats. The only thing wrong is that the PR interval is prolonged, meaning it's greater than 200 milliseconds. And it stays that way consistently from one beat to the next. So, if you see a consistently long PR interval with a 1:1 P2 QRS ratio, you've found a first-degree AV block. That's it. Now for second-degree AV block. This one gets a little more interesting, because it comes in 2 distinct flavors you absolutely need to tell apart: Mobitz Type 1 and Mobitz Type 2. Let's start with Mobitz Type 1, which you'll also hear called Wenckebach. This rhythm has a very specific, repeating pattern. The PR interval gets progressively longer with each beat, until POPA QRS complex is dropped entirely. Then the whole cycle starts over. The classic mnemonic for this is longer, 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 drop. Another great way to remember it is that Wenckebach gives you a warning. The gradually lengthening PR intervals are warning you that a beat is about to be dropped. So, on the EKG, look for PR intervals that are already prolonged, but are stretching out even more before a P wave stands all by itself. Next up is Mobitz Type 2. This one is much more unpredictable, and therefore, more dangerous. In Mobitz Type 2, the PR interval is prolonged, but it's constant. It does not get longer with each beat. Everything looks stable, beat after beat, descend, until suddenly, out of nowhere, a QRS complex is dropped. There's no warning. Because of this, you can think of Mobitz Type 2 as a first-degree AV block, with randomly dropped beats. On the EKG, you'll see those fixed, long PR intervals, followed by a P wave that suddenly has no QRS after it. Finally, we arrive at third-degree AV block, also known as complete heart block. This is arguably the most important and highest-yield AV block for Step 1. In a third-degree block, there is a complete electrical dissociation between the atria and the ventricles. They are totally independent. The atria are firing away at their own pace, and the ventricles are firing away at theirs. But there is zero communication between them. Think on the EKG. This creates a unique picture. The P2P intervals are regular and constant, and the R2R intervals are also regular and constant. And this is the key: there is no logical relationship between the P waves and the QRS complexes. They're just doing their own thing. P waves might appear right before a QRS, right after it, or they might even get buried inside a QRS or a T wave, which can make the rhythm look really chaotic at first glance. If you're looking at a strip and struggling to find the P waves, don't panic. Instead, use your calipers or a piece of paper and march out the intervals. If the atrial rhythm is regular and the ventricular rhythm is regular, they are clearly marching to the beat of their own separate drummers. You are looking at a third-degree AV block. Clinically, these patients are almost always symptomatic with significant bradycardia, dizziness, and fatigue, making them a medical emergency. So, let's do a quick recap to lock this in. AV blocks are high-yield must-know rhythms for your exam. First-degree block, a prolonged constant PR interval with no dropped beats. Second-degree block comes in two types. Mobitz type 1, or Wenckebach is longer drop, where the PR interval progressively lengthens. Mobitz type 2 has a constant PR interval but with unpredictable sudden dropped beats. And third-degree block, complete electrical chaos, where the atria and ventricles are totally dissociated, each beating at their own regular rate. My advice: review these EKG patterns a few times, do some practice questions to train your eyes to spot them quickly, and you will feel so much more confident on exam day. Got this! Thanks for watching, and be sure to like and subscribe for more high-yield content. See you in the next video.